Blood sugar has become the villain of the internet. People fear every carbohydrate, every meal, and every small rise on a wearable graph. But glucose is not a poison. Your body uses it as fuel. The real story is not about eliminating glucose. It is about understanding how the body manages energy. Ask the Feynman question. If glucose is so dangerous, why does the body work so carefully to maintain it in the bloodstream? The answer is simple. Your cells need energy. Your muscles use it. Your brain depends on a steady supply. The body is not trying to destroy glucose. It is trying to manage it. Blood sugar is simply the amount of glucose circulating in the blood. After you eat certain foods, especially carbohydrates, digestion releases glucose into circulation. That rise is not automatically a crisis. It is part of normal physiology. The important question is how effectively the body handles the incoming fuel. Behind your stomach sits the pancreas. One of its jobs is to release insulin. Insulin helps the body manage glucose after meals. Think of insulin as a message. Fuel has arrived. Cells should prepare to use it, store it, or redirect it where it is needed. You may hear that insulin is a key. The analogy is useful. Insulin helps glucose move from the bloodstream into cells. But biology is more complex than one lock and one key. Muscles, liver, activity, meal composition, hormones, sleep medication, and health conditions can all influence the system. Imagine glucose as delivery trucks carrying energy. The bloodstream is the road. Your muscles and liver are important warehouses. Insulin helps direct traffic. A healthy system does not ban deliveries. It receives them, uses a fuel, and prevents the road from remaining overcrowded. The word carbohydrate hides important differences. Lentils, oats, fruit, sweet drinks, candy, and refined snacks are not identical packages. They can differ in fiber, water, structure, portion size, and speed of digestion. The body responds to the complete package, not merely the word carbohydrate. Compare an apple with a sugary drink. Both may contain sugar, but the apple arrives with fiber, water, structure, and chewing. The sweet drink can deliver a larger amount of sugar quickly with little resistance. The difference is not simply sweetness. The difference is the delivery system. Think of fiber as one of the speed bumps in digestion. It can slow the arrival of energy and support fullness. It also supports digestive health. A meal built around whole foods usually gives the body more time and more useful structure than a drink designed to disappear in minutes. Food rarely arrives as one isolated nutrient. Protein, fats, fiber, and portion size can change how a meal feels and how steadily energy arrives. This is why a balanced meal often creates a different experience from eating a highly refined snack alone. Blood glucose normally changes after eating. A graph does not need to become a perfectly flat road. Your body is supposed to respond to food. The mistake is turning every visible rise into a moral failure. A wearable graph is data, not a report card. Diabetes is not simply one unusual reading after lunch. It is a medical condition involving insulin production, insulin effectiveness, or both. Persistently high blood glucose can damage the body over time. Diagnosis belongs in a medical context, not in a social media comment section. Your muscles are not only for strength, they are important destinations for glucose. When muscles work, they use energy. Movement tells the body that fuel is needed. This is one reason physical activity matters for metabolic health. After eating, do not assume that the only option is sitting. A short walk can give your muscles something useful to do. The goal is not to erase the meal. The goal is to replace prolonged stillness with movement and give circulating energy an active destination. Now imagine eating and remaining seated for hours. The warehouses are quiet. The muscles demand less fuel. The body can still manage energy, but the daily pattern has changed. Modern life removes ordinary movement at exactly the moments when movement may be useful. Strength training adds another signal. When you challenge your muscles appropriately, the body has a reason to preserve useful tissue. More importantly, your muscles continue participating in energy management. The point is not appearance alone. The point is capacity. Added sugar does not only appear in candy. It can hide in flavored coffee, energy drinks, sports drinks, cereals, sauces, sweetened yogurt, and packaged snacks. The label may look healthy while the product quietly adds more sweetness than you expected. Sweetened drinks deserve special attention because they're easy to consume quickly. Soda is obvious, but bottled coffees, iced teas, energy drinks, and sports drinks can also contain added sugars. A liquid can look ordinary while delivering a large amount of sweetness. Water does not need a dramatic wellness claim. It is simply a practical replacement for many sugary drinks. You do not need a detox. You do not need a complicated powder. Sometimes the most useful change is choosing the drink that does not add another delivery truck to the road. People often describe a sugar crash. The experience may feel real, but fatigue has many possible causes. Sleep, stress, meal size, hydration, caffeine, medication, and health conditions can all matter. Do not diagnose the entire body from one afternoon slump. Sleep is not separate from metabolic health. Poor sleep can make food decisions harder, energy feel less stable, and healthy routines more difficult to maintain. When you are exhausted, quick energy snacks and late caffeine may feel more attractive. The pattern begins to reinforce itself. Stress prepares the body for action. Energy becomes more available because the body expects you to react. That response makes sense during danger. But modern stress can prepare the body for a sprint while you remain seated in front of a screen. Continuous glucose monitors can reveal patterns throughout the day and night. For people managing diabetes, these devices may be valuable tools. Consumer access has also expanded, but seeing more data does not automatically mean understanding more biology. A wearable can be useful. It can also create anxiety when every meal becomes an experiment and every rise becomes a threat. Data should help you make informed decisions. It should not turn eating into a daily examination that you are always afraid to fail. The goal is not a perfectly flat glucose graph. Your body is alive. It responds to food, movement, stress, illness, sleep, and time of day. A healthy system adapts. Do not confuse rigidity with health. A continuous glucose monitor can provide information. It cannot diagnose every symptom. It cannot replace clinical testing. It cannot tell you the complete cause of a concerning pattern. Technology is a clue. Interpretation still matters. The internet often talks only about lowering glucose. But blood glucose can also become dangerously low, especially for people using insulin or certain diabetes medications. Shaking, sweating, confusion, or fainting can require urgent attention. Biology does not reward extremes. Physical activity often lowers blood glucose. That can be helpful, but people taking insulin or certain medications may need individualized guidance because exercise can increase the risk of low blood glucose. A general wellness tip is not a substitute for a personal treatment plan. Persistent thirst, frequent urination, blurred vision, unusual tiredness, or unintended weight loss deserve medical attention. These symptoms can have different causes, but they should not be dismissed or self-treated with a trending diet. Some metabolic problems develop quietly. You may not feel a dramatic warning at first. Appropriate screening can identify concerns earlier. A health video can explain the system. It cannot determine your diagnosis. A practical meal does not need to fear carbohydrates. Build context. Add vegetables. Include an appropriate protein source. Choose fiber-rich carbohydrates where practical. Pay attention to portions. The goal is not a perfect plate. The goal is a repeatable pattern. When dietary change feels overwhelming, begin with beverages. Notice how often sugar arrives in liquid form. Replace one sweet drink with water or an unsweetened option. This is not a punishment. It is a simple way to reduce an easy source of added sugar. Do not redesign your entire life on Monday morning. Attach one short walk to one meal. Choose breakfast, lunch, or dinner. Keep the routine realistic. A small habit repeated consistently teaches the body more than one heroic workout, followed by 6 days of stillness. Add resistance training where appropriate. Push, pull, squat, hinge, carry, or use a modified exercise that fits your ability. You do not need a bodybuilding routine. Your muscles simply need a reason to remain useful. Protect sleep where practical. Reduce unnecessary scrolling late at night. Give the body a clearer ending to the day. Sleep is not a glucose hack. It is part of the environment in which your appetite, energy, movement, and decisions operate. Try a simple 7-day experiment. Replace one sugary drink with water. Walk after one meal. Add one fiber-rich food. Complete 2 manageable strength sessions. Protect your bedtime. Do not obsess over a perfect graph. Observe how your routine changes. Do not diagnose diabetes, insulin resistance, or reactive hypoglycemia from a short video. Do not stop prescribed medication because of an influencer. Do not use one wearable reading to explain every symptom. When concerns persist, seek qualified medical guidance. Can you explain blood sugar in one sentence? Try this. Glucose is fuel carried to the blood, and insulin helps the body manage where that fuel goes after it arrives. Your body does not need fear. It needs support. Eat a balanced pattern. Move regularly. Use your muscles. Protect sleep. Reduce unnecessary added sugars. Seek appropriate screening when needed. Technology can provide clues, but daily habits still shape the environment. Your blood sugar is not the enemy. Your body is a fuel management system. Respect the system. Give it movement. Give it sleep. Give it balanced meals. Stop chasing a perfectly flat graph. The goal is not to fear fuel. The goal is to help your body manage it well.